I'm Dr. Bruce Dorn. I'm an optometrist, and my practice is full scope of practice. So we have a dispensary, we have a medical practice, but we really specialize in dry eye for about the last 18 years. One of the questions I often ask my patients, I say, why do you have tears? What is dry eye? And what a lot of people don't realize is our tears are there to provide oxygen to the cornea. We're producing this oil all day long. We blink to spread out that oil. That oil literally is absorbing oxygen from the air around us. So if we have dry eye, what's happening to us very slowly over many weeks or months or years is we're actually kind of starving our cornea for oxygen. So it is very important for the health of our eye to have a normal tear film and to try to treat that dry eye patient. A lot of patients come into my office with complaints of chronic tearing, and what they don't realize is that's actually a symptom of very severe dry eye. Normally we're producing a very small amount of oily tear, and that really coats the front of the eye and makes the eye healthy. But if you don't have a good quality tear film, the body will tell the lacrimal gland, the big gland, to start dumping salt water down. And now you get this chronic tearing, especially if it's windy or if it's cold, and that actually is a form of very severe paradoxical dry eye. When I talk to patients about dry eye, I really break down dry eye into two basic categories. One category is MGD, or meibomian gland dysfunction, which is just the glands are literally plugged. It's like a waxy buildup, the glands are blocked, and we need to get them open. The second type of dry eye is more inflammatory. There's kind of very small neovascular blood vessels that are growing near the eyelid margin. They're a little bit leaky, they leak inflammatory cells, and this can badly damage or impair the function of those glands. So it's very important that we use Forma-I and Lumecca-I to treat both those forms of dry eye and get that patient producing their own normal tear film. So Envision has allowed us to offer our patients a completely new way of treating dry eye. The Forma-I, which is radiofrequency that can be used on upper and lower lids without a shield, without a consumable. We have Lumecca-I, which is a small spot size that can be used on upper and lower lids as well. Historically, we've only had a medical model. We had to put people on drops, and they were forced to be on these drops for the rest of their life. Very expensive. It's very hard to get people to be compliant with something like that, and really the efficacy of that was actually quite low. What I really love about the Envision platform is we now have something brand new, much more effective. We can treat people early and effectively and get them off drops for the rest of their life and get them producing their own tears, which is much healthier in the long run.
I was using eye ointment and eye drops and the compresses, but they really weren't doing the trick. And Dr. Dorn told me about this new technology that he had that would really help. In fact, it might even be necessary for my condition. And that's when I started noticing a difference.
The treatment itself, I would say, is definitely worth it. You can't really put a price on clear vision, so I definitely am quite happy with the results.
So when patients come in for their treatments, especially with Forma-I, they find the treatment extremely comfortable. They kind of describe it as being like a hot stone treatment. They have no problems at all. I have the odd patient that's almost falling asleep during the treatment, so that's really great, and it works extremely well for MGD patients. With Lumecca-I, because we have that very precise spot size and we can go right along the lid margin, it is very precise, very comfortable for patients, it's very well tolerated, and we get just really good outcomes because both those devices are made specifically for eyelids.
These treatments were not painful, or there was no discomfort, and they did not take a lot of time, and I would recommend them to anybody who has dry eye.
What's really unique about the Forma-I and the Lumecca-I is we have now handpieces that are designed for eyelids, so we can specifically treat the eyelid. And what we're really trying to do is we're trying to get away from the medical model of treating patients, where patients are on drops and they're prescribed a lifetime of artificial tears that they have to comply with, which is quite honestly very difficult for patients long term. I have patients that are referred to my office that are literally taking 70 or 80 drops a day just to get some form of relief. And even when they take those drops, they're not getting much more than 5 minutes of relief from that artificial tear, and they have to keep retaking those drops. Over time, this becomes a very expensive endeavor. They're buying constantly, usually non-preserved artificial tears, which are quite expensive. We can now focus on rejuvenating those glands, getting them healthier, getting that patient to produce their own tear film, which in the long run is much more cost effective and much more healthier to that patient.